1. Introduction. ROSEP view. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only. For home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions, yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable. Wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree, but it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut-down and burned tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lungs, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom, the Eco-Design Wood Stove, and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. ROSEP view. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.
Hi, my name is Lily. Andrew gave you the intro to residents against wood smoke emission particulates and their concern for air pollution from indoor residential wood burning. Residents against wood smoke emission particulates, or ROSEP, would like every near neighbor of an indoor residential wood burner whose wood smoke enters their yards and sickens the near neighbors to have a purple air PM 2.5 monitor hanging from the eaves of their home to measure the level of PM 2.5 entering their yards. That measurement of air pollution should be used as evidence of unnecessary air pollution, and each indoor residential wood burner should be shut down based on that evidence, one indoor residential wood burner at a time if necessary. The presentation by Andrew ended at 2 minutes 5 seconds. The same presentation by Emma starts at 2 minutes 3 seconds before the end of this podcast. So I am Lily, your timekeeper, and you can start the next podcast at 2 minutes 5 seconds in if you would not like to see the presentation by Andrew a second time. This presentation by me, Lily, ends at 5 minutes in. What you will see in the main content of this ROSEP podcast will be news about air pollution from indoor residential wood burning and how that air pollution is being combated by ordinary people just like you who are unfortunately near neighbors of indoor residential wood burners at this time. There will also be news about unnecessary and highly polluting use of wood as fuel in industrial wood burners and preventable air pollution from wood burning wildfires. There will also be news about air pollution from PM 2.5 from gas-powered cars. There will also be news about airborne diseases which are also preventable with vaccines such as COVID-19 and measles and whooping cough, to name just a few. In 2025, residents against wood smoke emission particulates is also concerned with combating the Trump destruction of government funding for programs which protect human health through the Department of Health and Human Services, and Trump destruction of programs which fund the science and medical research plan to protect human health from preventable illnesses. Protecting human health is a patriotic act, and our defense against enemies is weakened if we are not as healthy as we can be. Heat pump rebates are now offered by the federal government, distributed through the eligible United States, are available in 2025 and are the best, cleanest, and now cheapest alternative to indoor residential wood burning if that burning is actually done to purportedly save money. Wind and solar as sources of the electricity that powers heat pumps and electric cars is also cheaper than burning wood. The adverse health effects that are caused by indoor residential wood burning also come at a cost to near neighbors, both in shortening and ending their lives and in actual hospital, clinic, and funeral costs. Instead of being compensated monetarily, near neighbors should instead be able to achieve immediate relief by stopping indoor residential wood burning in their hyper-localized neighborhoods, which relief readings from purple air PM 2.5 monitors used as evidence of air pollution will help them achieve. Welcome to news about hopeful scientific and medical achievements that will also help us achieve the goal of clean air to breathe.
Webisode 57DHXYX October 28, 2025 EPA faces lawsuit to reinstate $7 billion in solar panel incentives. In Webisode 57DHXYX 1 KFF Health Newsletter 2 Google Alerts Main Content. 1 KFF Health Newsletter Tuesday, October 28, 2025 Morning Briefing KFF Health News Original Stories 1 Ticking Clock How States are preparing for a last-minute Obamacare deal 2 Many fear federal loan caps will deter aspiring doctors and worsen MD shortage 3 Listener DIY project helps others deal with high medical bills 4 Political cartoon trick or treatment. Spending and fiscal battles 5 and Pivot. A union of federal workers calls for immediate end to shut down 10 GLP-1 drugs have rapidly lowered American obesity rates. Survey shows Editorials and Opinions 11 Viewpoints debt pushes med students away from primary care. From KFF Health News KFF Health News Original Stories 1 Even if Congress strikes a deal soon to extend more generous Affordable Care Act subsidies, the prices and types of ACA plans available could change dramatically. Unprecedented uncertainty and upheaval could cloud this 2025 open enrollment season, which begins in most states on Saturday. Amanda cites and Julie Appleby October 28 too. Healthcare professionals fear that new caps on federal student lending set to start in July will put medical school out of reach for many who want to become doctors and exacerbate physician shortages. Others say unlimited federal lending has fed a rise in academic costs, saddling families and ultimately taxpayers with debt. Bernard J. Wolfson October 28, 3A Medical Student DIY Project brings an arm and a leg listeners together with new tools to fight medical debt. Dan Weissman October 28. Here is the health policy haiku for today. Hurdles to healthcare. Doctor, please see me. I want to be healthy now. You are out of network. Haikus follow the format of 5, then 7, then 5 syllable summaries of the news, spending, and fiscal battles. 5. The president of the American Federation of Government Employees suggested that negotiations over the healthcare demands of Democrats should continue only after the government is reopened. Separately, news outlets cover the Obamacare price hikes headed for residents in New Jersey, Illinois, Arizona, and Colorado. The New York Times, the largest union of federal workers, called on Monday for Congress to pass a spending bill to immediately end the government shutdown, effectively siding with President Trump and Republicans who have opposed Democratic efforts to restore healthcare spending. Both political parties have made their point, and still there is no clear end in sight. Cameron October 27th. Politico. Here is where the 7 most vulnerable House Republicans stand on an ACA extension. House Republicans in the toughest races in the country are not on board to extend expiring Obamacare subsidies, yet the Cook Political Report, a nonpartisan election handicapper, detailed 7 House Republican races in the toss-up category ahead of the 2026 midterms. The races are likely to be close next year, and even a small shift could decide the House. Majority Republicans currently hold a 6-seat margin that is slated to shrink to 5 when a newly elected Democrat is sworn in. King October 27. States brace for higher ACA costs. Politico. New Jerseyans who purchase health insurance through the state exchange will see an average increase of nearly 175% in their premiums next year, the Murphy administration announced Monday. The State Department of Banking and Insurance said the sticker shock is attributed to the expiration of enhanced federal health insurance subsidies, which have been the key sticking point of the federal government shutdown. Han October 27. Chicago Tribune. Illinois residents will pay an average of 78% more across the state for health insurance through the Affordable Care Act exchange if Congress does not extend enhanced premium tax credits. The issue at the heart of the current government shutdown, state regulators said Monday. Schenker October 27. KJZZ Phoenix. What to expect if Obamacare premiums hit as much as $2,000 a month in Arizona? I do think that people are either going to forego care or we are going to see a huge rise in uncompensated care, and the system at this point really cannot take the additional burden of more uncompensated care. Brody October 27th. The Colorado Sun. The average person in Colorado who buys health insurance without help from an employer will see what they pay more than double next year as the state released final prices before open enrollment begins next week. Ingold October 28. KFF Health News. A ticking clock. How states are preparing for a last-minute Obamacare deal. One family in Virginia Beach, Virginia, just found out their health plan deductible will jump from $800 to $20,000 next year. About 200 miles north in Maryland, another household learned they will pay $500 more monthly to insure their brood in 2026, and thousands of people in Idaho were greeted with insurance rates that will cost on average $100 more every month as shopping season opens for Affordable Care Act plans. In some states, customers are confronting staggering costs for their health insurance next year. The extra federal subsidies put in place in 2021 that made coverage more affordable for millions of people will expire at the end of this year unless a gridlocked and idle Congress acts. Cites and Appleby October 28. More health news from the Trump administration. CNN. Trump administration delays release of new dietary guidelines amid shutdown. The Trump administration is delaying the release of new national dietary guidelines after the government shutdown disrupted efforts to finalize the overhaul by the end of October, officials said. Cankren and Owermole October 27. KFF Health News. Many fear federal loan caps will deter aspiring doctors and worsen MD shortage. Medical educators and health professionals warn that new federal student loan caps in the Trump tax cut law could make it more expensive for many people to become doctors and could exacerbate physician shortages nationwide. They warn the economic burden will steer many medical students to lucrative specialties in more affluent urban areas rather than lower-paying primary care jobs in underserved and rural communities where doctors are in shortest supply. Wolfson October 28. Healthcare costs. Modern Healthcare. CVS Health to close 16 Oak Street Health clinics. CVS Health plans to close 16 Oak Street Health sites by the end of February due to financial challenges, including higher medical costs. The company, which is in the midst of a $2 billion cost-cutting strategy, said Monday it will continue to operate 230 centers across 27 states following the closures. The move positions Oak Street Health for sustainable long-term growth as we continue to navigate external challenges such as elevated medical cost. Centers for Medicare and Medicaid Services risk adjustment model changes and health plan payer dynamics. CVS Health said in a statement. De Silva, October 27. Mississippi Today leader of Greenwood Hospital, says dispute with Mississippi Medicaid could lead to reduced services. Greenwood LaFleur Hospital, plagued by financial hardship for years, saw a bright spot this spring when it was selected for a new federal payment status. But a dispute with Mississippi Medicaid could jeopardize the ability of the Greenwood Public Hospital to keep services open if a resolution is not reached. Its leader says access to services will be reduced for residents of the Central Delta region. Interim CEO Gary Marchand told Mississippi Today he said no decisions about service changes have been made yet. Dilworth, October 27. The Hill, many voters say healthcare unaffordable are open to new insurance system. Poll. New polling has found that the majority of voters say healthcare in the U.S. is unaffordable and are open to a health insurance system that does not tie coverage to employment. Undo Medical Debt, a nonprofit that works to eliminate medical debt and supports policies to prevent new debt, sponsored the poll, which was led by the nonpartisan research firm Perry Undem, along with a national survey. Focus groups were also asked for their opinions on healthcare. Choi, October 27. Fears healthcare patients are blaming insurers for medical debt. Survey. U.S. consumers across the political spectrum are largely in favor of new legal protections against medical debt, and the majority are laying blame at the feet of the insurance industry rather than other healthcare players like hospitals or drug makers, according to a new national survey. The poll of 13/19/2024 general election voters fielded between August 21st and September 2, 2025 found about 35% currently owed money or have debts due to medical and dental expenses. 84% said they believed having health insurance should protect people from medical debt, and 74% said the current health insurance system of this country is mostly failing in protecting from medical debt. Moyo, October 27. KFF Health News and ARM and a listener DIY project helps others deal with high medical bills. In April, Thomas Sanford, a medical student who regularly listens to an ARM and a leg, set out to create a resource he could easily share with patients to help them deal with unaffordable medical bills. In this mini episode, host Dan Weissman talks with Sanford about how handing out charity care information on tiny cards snowballed into an ever-growing list of resources to erase medical debt. They discuss the inspiration behind his project, the role an ARM and a leg listeners played in building it, and how others can contribute. Weissman, October 28. 2 Google Alerts. United States confused homeowner seeks honest input about installing a high-tech HVAC in 56-year-old home. The cool-down heat pumps are more energy efficient than traditional home heating and cooling solutions, and because of their efficiency, they also qualify for United States Consumer Reports. Data shows these are the 2 best heat pump brands of 2025 so far. Yahoo heat pumps are frequently one of the most popular items that homeowners are investing in, according to Consumer Reports. These 2 brands have the United States disgruntled homeowner goes off after exposing frustrating trend among HVAC installers. The cool-down heat pump. Thanks to the Inflation Reduction Act, you could score up to an $8,000 rebate for a heat pump until 2031, or while funding lasts. United States engineer calls out uproar over high-tech HVAC systems gaining popularity. The cool-down heat pumps offer long-term savings because they can be more energy efficient than traditional heating and air conditioning units. United States EPA faces sweeping lawsuit to reinstate $7 billion in solar panel incentives. The cool down. Thanks to the Inflation Reduction Act, you could score up to an $8,000 rebate for a heat pump until 2031, or while funding lasts. View. If you are hoping solar for all will be reinstated, here is an AI overview. A coalition of 19 states, tribal governments, and other groups has filed a lawsuit against the Environmental Protection Agency EPA to reinstate $7 billion in funding for the Solar for All program. The plaintiffs argue that the EPA cancellation of the grants was illegal and unconstitutional, as the funding was already legally obligated by Congress, and the EPA did not have the authority to terminate it. The lawsuit seeks to have the grants reinstated, arguing that their cancellation will harm low-income communities and cause job losses. In addition to California and Arizona, states participating in the lawsuits include Maryland, Colorado, Connecticut, Hawaii, Illinois, Kentucky, Maine, Massachusetts, Michigan, Minnesota, Nevada, New Jersey, New Mexico, New York, North Carolina, Oregon, Pennsylvania, Rhode Island, Vermont, Washington, Wisconsin, and the city of Washington, D.C. United States harnessing the American heat pump moment. Hacker News. I have a heat pump water heater and a heat pump heating system in my HVAC, especially with rebate and incentive stacks in many places. A heat pump. While I get that these heat pumps are better for the environment and much more efficient, it is a last mile issue. The installers charge an arm and a leg. United States heat pumps still too expensive for third of homes. Yahoo survey found that just 1 in 3 homeowners were open to installing a heat pump, and of these, 66 PC were put off by the cost. The government. United States homeowner stunned after hopping on growing HVAC trend that puts older systems to shame. The cool down heat pumps save homeowners an average of nearly $400 annually on their energy costs. Reliable heat pump brands like Mitsubishi help homeowners choose United States. New multi-state report reveals key strategies to help homeowners burdened by costly utilities. Cool down heat pump adoption is on the rise as homeowners look for ways to save. However, some households may still qualify for federal rebate programs. Even United States REAM supports heat pump water heater day efforts. Morningstar heat pump water heating systems offer homeowners the comfort and convenience of modern living, and this technology will play a significant role in United States. Tired of your old stove? Many American homeowners can receive over $800 in government to cool down, while the federal tax credits for home improvements like solar panels and heat pumps will expire by the end of the year. The induction stove rebates. California San Francisco Bay Area Air District responds to concerns over spare the air alert. Increase times. HeraldOnline.com. Would smoke exposure, even assuming a free source of wood, and frequent burning, the added cost for using another source of heat on the additional. Colorado Chaffee County Buena Vista commissioners continue discussion of draft burn ordinance. The Mountain Mail Commissioner PT Wood said the draft has some good stuff in there, and the county needs a modern, updated burn policy. Hopefully you guys can all commissioners heard a brief update from local fire officials before continuing discussion of Ordinance 2025-03, which would restrict open fires and open burning in unincorporated areas of Chaffee County and provide penalties for violation. Massachusetts Bedford FW Web launches online rebate center supply house times. For example, a contractor in Bedford, Massachusetts might see rebates for a Rheem 5-ton side discharge universal heat pump from the Endeavor line Prestige. New York Long Island PSEG Long Island hosts 3 events, offers up to $78 per month. APG stock news, stock Titan energy saving tips, and rebate details, including smart thermostat and heat pump rebates, are available at psegliney.com. Save energy and money. Washington Seattle financial and environmental benefits of installing a heat pump. The Seattle Times: when a home uses a heat pump instead of standard electric resistance heating tax credit or a rebate, says Ms. Catello, specialist at the Dakin, we have advanced technologically with those heat pumps such that they can save more energy, produce more comfort, and have more of an environmental. Washington Vancouver utility company offers up to $1,500 for home upgrades. This is definitely a priority news break. The heat pump water heater rebate is just one part of the Clark Public Utilities larger program of incentives and rebates that offers residents money. The cool down. Clark Public Utilities in Washington has raised the incentive for its heat pump water heater rebate program to $1,500. Australia, Brazil, Canada, Chile, China, New Zealand, Taiwan, Thailand. Impact of global short-term landscape fire source PM 2.5 exposure on child cause specific morbidity. Nature. Here we show that short-term exposure to LFS PM 2.5 is associated with increased hospital admissions for multiple diseases in children and adolescents. PubMed: children are particularly vulnerable to landscape fire. Sourced fine particulate matter LFS PM 2.5, yet evidence on its health effects remains. AI overview. LFS PM 2.5 refers to landscape fire sourced fine particulate matter, which is the tiny particulate matter PM 2.5 produced by fires such as wildfires that are used in land management or ignite from natural causes. PM 2.5 are particulate matter with a diameter of 2.5 micrometers or smaller, and when they come from landscape fires, they can have significant, sometimes temporary health impacts, especially on children and adolescents. LFS acronym for landscape fire sourced health effects: increased hospital admissions. Short-term exposure to LFS PM 2.5 is linked to more hospital admissions for various conditions in children and adolescents. Respiratory and cardiovascular problems. Exposure can increase the risk of asthma, heart disease, and other cardiovascular issues. Other risk studies have also associated exposure with increased hospital admissions for neurological, digestive, and cancer related conditions. Why it is a concern: high concentrations. The concentration of LFS PM 2.5 can become extremely high during and after landscape fire events, persisting for weeks. Penetration into the body. Its small size allows it to be deeply inhaled into the lungs and can even enter the bloodstream, causing inflammation and other health problems. Summary of LFS PM 2.5 levels and hospital admissions. Communities in Brazil, Chile, and Thailand experienced higher LFS PM 2.5 levels compared with other regions. The median concentration of LFS PM 2.5 was 1.2 micrograms per cubic meter. Interquartile range IQR 25th to 75th 0.4 to 3.4 micrograms per cubic meter. Among the study locations, Chile recorded the highest LFS PM 2.5 exposure with a median concentration of 9.5 micrograms per cubic meter. Interquartile range IQR 5.1 to 15.5 micrograms per cubic meter, followed by Brazil 2.2 micrograms per cubic meter. Interquartile range IQR 0.9 to 5.7 micrograms per cubic meter, and Thailand 1.6 micrograms per cubic meter. Interquartile range IQR 0.6 to 7.7 micrograms per cubic meter. Moderate levels were observed in Australia, 1.1 micrograms per cubic meter. Interquartile range IQR 0.5 to 2.5 micrograms per cubic meter. In Taiwan, 1.1 micrograms per cubic meter. Interquartile range IQR 0.5 to 1.9 micrograms per cubic meter, while New Zealand 0.7 micrograms per cubic meter. Interquartile range IQR 0.3 to 1.6 micrograms per cubic meter had slightly lower levels. The lowest LFS PM 2.5 concentrations were recorded in Canada, 0.3 micrograms per cubic meter. Interquartile range IQR 0.1 to 1.0 micrograms per cubic meter during 2000 to 2019-60. 7.9 million all-cause, 31.4 million, 46.3% girls. Hospital admissions among children and adolescents aged 0 to 19 years were recorded. Authors and affiliations: Brisbane, Queensland, Australia; Hobart, Tasmania, Australia; Melbourne, Victoria, Australia; Perth, Western Australia; Sydney, New South Wales, Australia; Sao Paulo, Brazil; Ottawa, Ontario, Canada; Santiago, Chile; Chongqing, China; Wellington, New Zealand; Taipei, Taiwan; Nakhon Pathom, Thailand. United Kingdom banning domestic wood burning could save 16,500 life years annually. Air quality news: air pollution from wood and coal burning in homes is contributing to thousands of premature deaths each year, according to a new health assessment. United Kingdom domestic wood burners kill thousands and cost NHS millions a year. Report suggests the BMJ Mums for Lungs accused the government of not following through on commitments to tighten emissions limits on wood burning stoves. This is a public health issue. Wood burning is a leading source of fine particulate pollution in the UK. 8 and the percentage of homes with wood burners rose from 9.4% in 2022 to United Kingdom. Ending domestic wood burning could save the NHS £54 million a year. ITV News: IDVX burning wood and coal at home contributes to the death of nearly 2,500 people each year in the UK, according to research. ITV National News. United Kingdom heat pumps judged quiet and efficient cooling. Post: UK Panasonic air source heat pumps have replaced 2 outdated and inefficient chillers, providing air conditioning to a 200-year-old court. United Kingdom, the hidden health costs of wood burning stoves and open fires. ITV News: IDVX burning wood and coal at home contributes to the death of nearly 2,500 people each year in the UK, according to research. ITV National News. Neighbors moan to councils about wood burners every 35 minutes. Daily Mail figures show 15,195 official complaints were made about smoke pollution created by wood burning between August 2024 and September 2025. United Kingdom: no prosecutions made after 15,195 wood burning complaints in a year. In England, The Guardian: in smoke control areas alone, 9,274 complaints were made, a 65% increase on the previous year. In these areas, households may burn wood or other United Kingdom only only one prosecution made after 15,195 wood-burning complaints in a year. In England, The Guardian, in these areas households may burn wood or other fuels only in stoves approved by the Department for Environment, Food and Rural Affairs DEFRA. United Kingdom, thousands of complaints about wood-burning stoves, but only 24 finds. The Times. Burning wood is one of the top contributors to PM 2.5 particulate air pollution, but councils are not enforcing the rules that protect health. United Kingdom, England towards cleaner air. PM 2.5 exposure and disparities around childcare providers. In England, ScienceDirect.com. Air pollution poses a significant health risk for young children, particularly in urban and deprived areas. Exposure to fine particulate matter. PM 2.5. United Kingdom, wood burners linked to 2,500 deaths a year in the UK. Analysis finds The Guardian use of wood burning stoves and fires in homes is mostly unnecessary and their toxic pollution costs the NHS millions. United Kingdom, wood burners linked to 2,500 deaths a year in the UK. Council-backed study claims Daily Mail non-essential domestic burning of wood and coal is one of the biggest sources of toxic fine particle air pollution in the UK, according to a report. Was United Kingdom, wood burning fires in homes linked to 2,500 deaths a year in the UK. Study says the independent wood burners produce a fine particulate matter linked to thousands of asthma and diabetes cases. AOL.com. Open fires and wood burning stoves are one of the biggest sources of small pollution particles. This fine particulate matter, PM 2.5, can penetrate deep into the lungs. United Kingdom, wood burning fires in homes linked to 2,500 deaths a year in the UK. Report says the independent burning wood and coal in homes contributes to about 2,500 deaths a year. A report has found open fires and wood burning stoves are one of the biggest. United Kingdom, wood burning linked to nearly 2,500 UK deaths a year. Study finds Forbes. The new research claims air pollution from burning wood in the home contributes an average of 3,741 new cases of diabetes and 1,493 new cases of United Kingdom, wood burning stoves linked to 2,500 deaths a year. Study finds SDV News. SDV player microscopic particles released by burning fuel can penetrate deep into the lungs and bloodstream, affecting every organ in the body. United Kingdom, Scotland, home insulation and heat pump help. BBC. In Scotland, if you are struggling to heat your home, you could be eligible for support from the Scottish government funded Warmer Home Scotland. India, Delhi pollution day after Diwali. India capital wakes up to toxic haze. BBC. On Tuesday, the air quality index AQI in Delhi was 360. The AQI measures the level of PM 2.5 fine particulate matter that can clog lungs and cause India. PM 2.5 rising. Diwali hangover hits the lungs of the city. Ludhiana News. The Times of India. Meanwhile, data of average PM 2.5 particulate matter with diameter of 2.5 micrometers or less that pose a significant health risk. 3 days. Iran-Tehran association between exposure to PM 2.5 and black carbon and risk of childhood leukemia. ScienceDirect.com. Annual concentrations of PM 2.5 in BC were estimated using the gradient boosting machine GBM algorithm integrating ground-based measurements with China. Analysis of the correlation between PM 2.5 and PM 10 concentrations in the epidemiology. Nature. This study aimed to analyze the epidemiological characteristics of severe mycoplasma pneumoniae in the pediatric intensive care unit PICU of China. Decadal variability of PM 2.5 associated nitrate in the megacity of Beijing, China. ScienceDirect.com. Atmospheric nitrate NO3, a key component of fine particulate matter. PM 2.5 significantly impacts air quality and climate. China. The interplay of urban landscape and PM 2.5 exposure disparities. A machine learning. ScienceDirect.com. Fine particulate matter with a diameter of less than 2.5 micrometers. PM 2.5 is a significant contributor to air pollution.
Red-green fox here. The quick red-green fox jumped over the barriers to clean air. Red-green fox here. Ready to sing to you the names of the 2025 major wood-burning biomass industry subsidy opponents. 1. Biofuel Watch. 2. Bulkley Valley Stewardship Coalition of British Columbia, Canada. 3. Comite Schoen Luft, which means Beautiful Air Committee in German. 4. Dogwood Alliance. 5. Equity Group Foundation, nicknamed EGF. 6. Environmental Paper Network, nicknamed EPN. 7. Natural Resources Defense Council, nicknamed NRDC. 8. Prakaunia Narzexwisistki Istit, which means Workshop for All Beings in Polish. 9. Rachel Carson Council. 10 Solutions for Our Climate, nicknamed SFOC.
Cat's corner strategy with Tiger and Leone. Saying the quiet part out loud. Roar. Hi, I am Tiger. Our human asked us to get up from our naps and start Cat's Corner strategy with Tiger and Leone. She gave us a list of internet allies which we will post for her here.
Hi, I am Leone. It is better for your mental fitness to go to these websites than to go to bro sites for advice. Substack letters from an American Heather Cox Richardson. Substack your local epidemiologist. The Midas Touch. The Guardian. The New York Times.
1. Introduction. Rosette View. The United States government was on track in the Biden administration to reduce the prices for both clean energy heat pumps and clean energy electric cars. Trump tariffs are expected to upset those plans to prevent future air pollution and prevent climate change. The United States government should, instead of certifying wood stoves as safe when they are not safe, go forward with regulations that ban wood stove use and direct government money for use of forest refuse only for home building and furniture building. For just a few examples of use of forest products for non-burning uses, it is well known from scientific and medical research that wood burning is a substantial source of PM 2.5 emissions. Yet the wood burning industry uses the scientifically debunked theory named carbon neutrality of wood burning to argue that wood burning replacing coal burning in industry, and in a trickle-down argument that wood burning should continue for home heating should continue. Presumably because it is called renewable, wood may be renewable in the sense that a tree can be planted in the place of a cut-down burned tree. But it takes centuries or decades for the newly planted tree to attain the stature of the cut-down burned tree. During those centuries or decades, photosynthesis, which converts CO2 to oxygen, and so sequesters some carbon, will not take place at the same rate as photosynthesis was performed previously, and wood burning emits both CO2 and PM 2.5, and PM 2.5 is not absorbed by trees, so PM 2.5 is not diminished by planting a tree in the place of a cut down and burn tree. In fact, a living tree closes its pores against the presence of PM 2.5 from nearby wood burning, just as humans hold their breath in the presence of PM 2.5 from nearby wood burning. And when a tree closes its pores, the level of photosynthesis that absorbs CO2 pollution goes down. Wood burning emits 90% PM 2.5 particulate matter of 2.5 micrometer size, the perfect size to infiltrate the human lung, setting off a cascade of human health problems and early deaths. Contrary to many beliefs, wood burning emits 2.8 times the PM 2.5 as the fossil fuel coal burning, and wood burning emits 450 times the PM 2.5 as the fossil fuel natural gas burning. Replacing coal burning with wood burning creates more air pollution in the form of CO2 and PM 2.5 than coal burning. This emission data comes from testing the cleanest burning wood stove in the United Kingdom. The Eco-Design Wood Stove and International Convention does not count the emissions from wood burning. The emissions from wood burning are erased from all countries around the world when calculating if each country has met its climate goals. This non-counting or erasure of wood burning emissions data from climate goals does not mean wood burning emissions do not exist. Rosette View. Purple air. PM 2.5 monitors hanging from the eaves of the house of a near neighbor should be used to measure the level of PM 2.5 in the air hyperlocally in the yards of near neighbors of indoor residential wood burners. If PM 2.5 levels exceed World Health Organization standards of 5 micrograms per cubic meter annually, then that evidence of air pollution from wood burning should lead to the shutdown of that indoor residential wood burning appliance, one appliance at a time if necessary.